Good morning, everyone, to the Thursday, December 16th media briefing. We'll jump right into media questions, and today we're going to start with AM 800.
Nicole, just in regards to the booster rollout, are I guess you and the team ready for this? Seems like it's going to be a busy couple of weeks here.
Yeah, are we ready for it? Maybe not as ready as we have been in the past, but as with everything, I think our team's great at pivoting, and we have on and on throughout the pandemic. So, since Friday, we've been working towards ramping up, redeploying our staff, connecting with all of our partners. So I think we're as ready as we can be.
Yeah, and if I could just supplement that as well, I think it's particularly important for people over 50 to get their third dose, and that's a real priority. Secondly, I think that like everything else in public health, it's a group of trade-offs, and as we curtail our activities for case and contact management to reassign people for vaccine, we're trying our very best to work within the resources we have, recognizing that we have to set certain priorities. And at this point, the province has articulated that the priority is to get people vaccinated. And we would encourage people to avail themselves of that opportunity. The other item is that although we can vaccinate perhaps 2,000 or a bit more than 2,000 people a day through various distribution channels, and that's a very robust delivery system, the sheer volume of the number of people that need to be vaccinated means that we need to bring on other lines of distribution. I'm hopeful that family doctors will also, more family doctors will supplement the distribution chain. And we've reached out to other practitioners as well so that we can enhance the number of people who get vaccinated on any given day. The effective of the vaccine is 2 weeks after the third injection, that additional benefit. So we still have a long ways to go to vaccinate the community.
Sorry, Doctor, is that 2,000 just at the Devonshire site, or that's throughout the entire community?
So we've been doing 2,000, our capacity for Devonshire is 2,000, and we're working with Windsor Regional Hospital to redeploy resources as well as working with the community to add additional resources to Devonshire so we can increase actually even above the 2,000 within the mass vaccination site. So that's just that one site as well. Again, we are, as Dr. Nissathuri said, we are talking about, the entirety of our adult population. So certainly we're working with our doctors in the community and pharmacies to see how they can increase capacity and bring on new providers who maybe previously weren't vaccinated and that can be part of adding to the solution.
And finally, just looking at the website for the booking, it goes all the way up to December 28th. No times available, I guess, all the way up until the 28th. There's only 2 days available, Boxing Day and the 28th. So obviously people are going to the site and making those appointments. Do you think you'll be extended that? I know it's usually about a 5 to 10 day period on the booking site with the holidays approaching. Do you think you'll be extending, I guess, that window?
You mean opening up more days? Yeah, our team meets regularly to talk about the booking site, obviously with yesterday's announcements, and we have a lot of changes to discuss and make. So, we have to be careful how far out we book because it is also based on capacity in our supply, ensuring that we are, ready to go. But as I said, we're trying to increase capacity. So, right now everything's booked, but we may be able to add additional appointments on additional days as we add resources.
Thank you.
Any questions from Radio Canada?
Yes, Nicole, yesterday you said that the N8H had one of the lowest vaccination rate in the region. So I would like to know if that postal code is actually among the ones that have a lot of greenhouses, and just want to know how you can explain that rate.
So that N8H would be it's our Leamington area. I think there's a lot of reasons that go into potentially why they may have a lower uptake. There are greenhouse and agriculture operations certainly out in our county and within that postal code as well. We did do quite a push for vaccination amongst, if you're asking regarding temporary foreign workers, we did quite a push related to vaccinating our temporary foreign workers and have quite a good vaccination uptake amongst that group, for full first and second doses, when we went out and did that push. But it'd be hard to explain, or give one reason why that area might be lower versus other areas. I think there are a lot of reasons for that. And Dr. Necessary may want to add, but
if I could supplement the answer, I think one thing to think about is at this point in the pandemic, everyone who had wanted vaccine could have received it, because there was multiple channels of vaccine distribution. And so up to this point, people who wanted vaccine could have received it through a variety of channels, through pharmacies, physician's office, community vaccination center, mass vaccination center. Secondly, as it relates to members of the migrant farm worker community who are a significant part of the Windsor-Essex community, they also have the additional opportunity to get vaccinated on their arrival at the airport. More importantly, and this is, I think, a really key point, is the people most vulnerable to Omicron hospitalization and death are those who are currently unvaccinated. And more than ever, this is the time, if you're unvaccinated, to get vaccinated. 2/3 of the deaths and hospitalizations are in people that are unvaccinated. And so that, to me, would be the priority at this point in time, to try to get that community of people vaccinated, no matter where they live in Windsor-Essex.
Mm-hmm. But for that specific region, you have about 40% of people who did not receive the vaccine. So do you think these people, I guess you assume that these people are more at risk, and do you intend to do a vaccination campaign in that area to boost the numbers?
So we have continued to, work with local partners in all areas where we are seeing, they're not the only, but in all areas, well, across Windsor-Essex. But then certainly we are working with partners to try to, sort of target or work with communities that might be lower to understand what might be leading to hesitancy and how that can be overcome, as well as improve access. As a health unit, we are working on plans to ensure or open up additional opportunities in the county, and in particular in that area, for vaccination in the near future. So that's something that we'll be able to report on a little bit more when we have more solid plans. But we are looking at in light of boosters for everyone, we are looking at adding additional capacity within the county for vaccination.
Thank you.
Yeah, I want to leave with this message. We will do everything we can to get people vaccinated at the health district. We can make it convenient. We can provide education, which we've done. We can have dialogue. We can reach out to leaders in any particular community. But at the end of the day, the people who are eligible for vaccine have to make that affirmative step to go get vaccinated. And to the point that you pointed out, some areas have lower vaccination rates than others. The Public Health Service is very concerned. Those 40% of people in that geographic area who are not vaccinated are at the highest risk. And we'll continue to try to reach out to them. I hope my colleagues in the media will also reach out to them and perhaps inquire about why people aren't getting vaccinated in the context of the pandemic and the number of deaths that we've seen in Windsor-Essex.
Thank you.
Any questions from CTV?
Yes, good morning. You said you were looking at adding additional capacity for vaccination. Now, would that include reopening additional mass vaccination sites?
Yes.
Okay.
Yeah, if I could
Get
just share.
straight to the point.
Yes. We are faced with an immense resource-contained environment. It's just not the physical space or the availability of vaccine and all those other things, but also the number of people to actually execute on the task. There are channels that have not been fully utilized up to this point, which include physicians' offices. And we're working diligently to see if we can reach out to those channels that are available. I believe there are 300 family doctors in the health district, and that is an established distribution channel. Family medicine is a cornerstone of public health practice. Without family doctors, we would not be able to achieve our health outcomes. And so we need to find ways to get vaccine through that channel that supplements pharmacies and the community vaccination program and mass vaccination centers. We reached out to the medical school, the regional campus, and I'm hopeful that they'll be able to be supportive as well. And I know they will be. We're reaching out to dentists if we can see if we can get our colleagues in the dental profession to see if they can provide support as well. So every possible method to effectuate distribution, we're willing to explore to try to get vaccine out to people as clinically appropriate.
Okay, thank you. Now, I know this isn't necessarily a local decision, but will individuals need the third shot to be considered fully vaccinated?
Well, the construct of fully vaccinated, as a general idea, doctors don't like to give simple answers. And so that's why I'm always really reluctant to use words fully or not fully vaccinated. You need the treatment that'll give you the best possible health outcome, balancing the risk versus benefits. And at this point in time, getting the third vaccine is the right clinical decision to make. So to the extent that what is the best clinical decision today, it's to get the third dose. And if we want to characterize that as fully vaccinated, that's fine. My guess is that this will be like the flu, which is that people need periodic vaccinations. The flu, it's every year. And I think that likely as we go through the pandemic, or likely as coronavirus is going to be around with us in our community, is that we're going to need periodic booster vaccinations. And that vaccination formulation might be modified based on the biological activity of the virus.
Okay, thank you. And what do you think of the new provincial capacity limits on large venues? Now, this was something that was left out of the local letter of instruction, but do you think this is a necessary step at this point?
So I'm going to give a long-winded answer, and you can cut me off. Public health measures, wearing a mask indoors, wearing a mask when you cannot stay consistently 2 meters away from people, reducing capacity at restaurants, limiting the number of people that you have for social interaction, case and contact management, which means isolating people or close contacts, all break the chain of transmission. And breaking the chain of transmission prevents vulnerable people from getting infected. And those are primarily unvaccinated people and vaccinated people with chronic medical problems. So capacity limits will help break the chain of transmission with all the other public health measures that have been effectuated, including the measures that have been effectuated by our health district and by others, including Kingston and Algoma and Peterborough, I believe, Chatham-Kent. So to the extent that that'll be one additional step, that's helpful. Quite honestly, that's insufficient. We need more public health measures from the province, and I would appeal to the province to act as quickly as possible. Because my concern, our jobs at the Public Health Service is to advocate for the people of Windsor-Essex. My concern is that the chain of transmission will not be sufficiently broken with the measures that are put forth. Vaccination will help prevent people as on a population health level but it'll take many weeks for that benefit to come to fruition because we can't vaccinate everyone in one day, and there's a time lag between the vaccine and the time that you get benefit. And if you're not vaccinated, you have to get your vaccine today, wait for your second injection, which will be a number of weeks, and then wait 2 weeks, and then you'll get some level of reasonable protection. So given all of that, I think that we welcome the province's leadership in putting together capacity measures. But I think in Windsor-Essex, we would ask the province to take additional measures immediately to try to help break the chain of transmission. One thing I fear, and I think others fear, is that we'll saturate hospital resources. And that's why, and if we saturate hospital resources, stated another way, we want to be sure that every person who goes to the hospital for whatever disease, COVID or non-COVID, heart attack, congestive heart failure, stroke, lymphoma, that they can go to the hospital and get sufficient medical treatment. If in fact that we have a flood of COVID-related cases, it's going to crowd out our ability to provide other services to other patients. So that's our public health strategy up to this point. Again, my apologies for being exhaustive on that response.
Thank you very much.
Any questions from CBC?
Yes, good morning again. Just to be clear, is registration open locally for 18 plus people looking to get their third dose?
So that and the announcement that went out yesterday said that 18 plus will start Monday. So right now, registration and appointment booking is open for 50 plus. Again, you know, we will look at our booking site, as the question was asked before, and how far out we go. And in the past, you know, we have opened it up a few days prior so that individuals who are going to become eligible can book on the days that they technically would be eligible. So, but right now it is restricted to 50 plus.
Thank you. And the last few times we've talked, you've mentioned there's about 50,000 people locally that are still not vaccinated. And I know the team's still working on, you know, how to target people more, but any sense of who you're going to target next, or, you know, how to break through to those 50,000 people? Are they calling you? Do you hear their concerns? Can you give me any insights on that?
Yeah, you know, do you want to speak first, Nicole? And I'm happy to.
Go ahead. Go ahead.
I've been reflecting on this, and I've talked to my colleagues. Up to this point, everyone in the health district, I think, knows the benefits of vaccination and the public health services recommendations and what doctors have recommended. We can reiterate that many of the deaths of people who died of COVID-19 in Windsor-Essex were senseless. People who died with many, many years of life to live, leaving behind families and children. So we can appeal to them on just a simple thing that they can help themselves and their families. But I think at this point, I think it's for the family. Everyone knows. I think the people who are currently unvaccinated, many times their family members, their spouses, their children know. And I think the dialogue has to be at a family level or at a personal level. I think for those people who have libertarian objections to getting vaccinated, I'd ask them to suspend those libertarian objections at this point and at least do it for this year so that we can try to get a bit better control of this. But I think that the real goal right now is dialogue with people as individuals. And I think that that dialogue has to happen among families and among people who love each other. I as much as I'd like to think that the public health service can effectuate that, I think that it's really that individual level, that's the individual level discussion that needs to happen. And it needs to happen soon because even if you get vaccinated today, there are many, many weeks before that you can get the full benefit of the vaccine. Nicole, did you want to supplement that, or?
Yeah, I don't know. We've been asked this before, and we also reflect on this every day. We do still see individuals that are coming out, and it's slower, but we are still vaccinating people with their first and second dose. So as Dr. eligible for quite some time, and we're just seeing them for now. We have collected at points in time, we have collected surveys. We also have called, the province, worked with the province to call individuals who had not yet received their vaccination. And there's a variety of reasons that are given. Convenience is one, and I would suspect that again, we would just continue to appeal that certainly the time we're in, I can't imagine anything, less convenient than COVID. And the best protection really is to get your vaccination. So, but a lot, definitely through our mobile outreach, I think that's still a very important strategy. It does assist with access. It, may be helpful for some folks who, prefer a more intimate environment for their vaccination. And again, we're going into neighborhoods and working with communities. And we do still see some first and second doses through that strategy, and we'll continue that strategy. We know it's important. And then also our primary care providers, again, I think, they're a big part of people who generally trust, their healthcare provider, and maybe more extensive conversations can happen there. And so, yeah, I wish I knew exactly what we could do. We've been working at this for a long time, but we'll continue with the sort of the large strategies, and then the smaller, more strategic strategies as we move forward.
Thank you. And another of the province's announcements yesterday was that they were going to provide free rapid testing at pop-up locations across the province. Windsor-Essex is currently not one of those locations, but I'm wondering if you've heard anything about the province about providing these rapid tests, and what your reaction is to that campaign.
Well, every option to contain COVID-19 is something that's on the table, and we'll continue to evaluate that. The province has made decisions to offer these rapid testing sites. I think the number I had heard was 50, but maybe you can confirm from the province where those sites might be. The one thing to consider is that in Windsor-Essex, we have excellent testing capacity at the current time. But so long as we have testing capacity through professionally obtained samples, I would prefer that people get those tests if they're concerned about their health status. But I think we have to wait and see how what's going to be announced for Windsor-Essex for this provincial initiative, and we welcome all the approaches to try to bring COVID-19 under control.
Thanks very much.
Any questions from Blackburn?
Yes, Dr. Shanker Hazzathuri, sorry. You mentioned that what the province is doing, more needs to be done, will not be sufficient. The rate of transmission will not be sufficiently broken because of the lag for when the vaccine is effective. What other measures would you like to see the province take at this time?
Well, I think that there's a whole suite of measures to control. Let me preface this by saying that previous characterization isn't exactly what I said. So, and we're happy to provide that quote. But I think that reducing capacity limits is one positive step. It's an incremental step to try to control COVID-19. However, that step in itself is not sufficient, and other steps need to be taken. I think at a province-wide level, reducing the size of social gatherings to a smaller number, like Windsor-Essex and other health districts have put in force would be helpful. So reducing capacity limit, social gatherings to 10 people indoors and 25 outdoors would be helpful. I think reducing capacity limits to retail would be helpful. There are other ways to reduce human-to-human interaction, which reduces the chances of human-to-human transmission. This is particularly important as we have to pull back from case and contact management to support vaccination. And case and contact management disproportionately benefits people who are unvaccinated. So these additional measures, I think, are important, but they should be implemented at a province-wide scale. The next point is that one reason to have province-wide guidance is that as a public health measure, as a public health policy, it's communication of the message is important. And if there's a patchwork or a heterogeneity of the guidance, depending on what county or what district you're in, that's a challenge. And the other issue is from a strictly operational point of view. People are going to be traveling from one part of the province to another for the holidays, be that young people leaving Kingston, which is right now an area with a serious number of cases, from the universities in Kingston to their hometown, or people traveling to see their family in other parts of the province. So to really capture the benefit, we really have to have province-wide direction. Also, I think it's important, and this is about a leadership issue, it's for the province to articulate what the province's policy is towards COVID-19. Local health officials, we're happy to do it, but I think it's easier to have messaging come from the highest levels of the province related to these measures. The endorsement of the province gives it that additional moral force or ethical force on why we have to move forward with this. So for those reasons, the health district believes that and welcomes the province's leadership in announcing these restrictions, and we believe that additional restrictions at a province-wide level are necessary. I hope that provides additional insight. I do want to be quoted correctly on this because the messaging is really important. And if you would like us to check the quote, you could just send it to Mike, and we can endorse. We can.
Oh, I'm rolling a tape. I'm rolling a tape. I
Good.
took that quote from my hand notes, but I refer to the tape. Don't worry.
Yeah, that's great. Yeah, because here's the thing, and this is important, is that we're all in this together. Public messaging is a key part of public health practice, and we want the message to be out there that we welcome the province's additional actions, but we also want the province to take additional measures on a province-wide level, as opposed to leaving these items to a health district by health district approach. The health district will act as it has to do, and it has always done that. But I think that it's better at this point in the pandemic to have province-wide direction as it relates to capacity limits. Sorry for being exhaustive on that as well. My apologies.
Oh, no, that provides a lot of insight. The other question I have is, how many people would you need to ramp up capacity? You mentioned that you're looking at space, you're looking at going to the dentist's office to see what they can do, the medical schools. Are you also looking at volunteers that perhaps worked, say, at the Libro Center the last time around when it was open? Is that something you're also looking at? And how many people would you need?
Yeah, so the amount of people, I think Nicole would have to answer, but yeah, we would, as a strategic measure, every person that we can get on board, including lay people, we'd explore that. But Nicole, maybe you can answer the resource questions.
Yeah, I don't have an exact number. Some of the number of people we need is also contingent on space. So you mentioned, the Libro Center and other facilities that were up and running in the summer. So, that dictates sort of the number of people we need. But I think the general message right now is, and as I said, we're still working on plans on additional spaces, but the general message is, we're looking for everyone and anyone to be be part of this. And, you know, the more we can increase the number of individuals who are able to vaccinate per day, the quicker we can get ahead, hopefully, and get everyone their booster shot. So I think that, you know, it's hard to give a exact number right now. We're still working on plans, and some of that is contingent on the spaces that we'll have available for vaccine.
One last question. Was there anything from today's EPI summary that stood out? I know that hasn't come down for us yet, but if you've had a chance to look at it, was there anything that stood out?
Well, there are many things that stand out. I guess that I think the number, and I don't have it, the number of cases per thousand, I think Windsor-Essex is number 4 in the province. So when it seems that Windsor-Essex always seems to be in the top group of people burdened by COVID-19. The other thing was the district that was number 1. Forgive me, let me see if I can get the data elements in front of me.
Is Kingston.
Kingston, yeah. I'm just looking at the slide deck here. Go ahead, Nicole. What was Kingston's number? I think it was 300.
Kingston is close to 300 per 100,000. I think the important thing, and you'll see in the IP summary for us for this week, is it is an increase over last week. So we're at 137 per 100,000 individuals. We're at 4th. I think Dr. Nasseri was going to highlight that last week Kingston was actually, I think, 4th. And they'd have had a bit of an explosion of cases, primarily related to Omicron. But at this point, we haven't seen a slow in our cases. We are still seeing increases over the last week.
So, yeah, the fact that the number of cases can explode in a very short time period is concerning, and those are at least some preliminary items that concern us about the EPI summary. I do want to share that there are things within our power that we can do, and we're doing them at this point in time. I think we need to have concerted action to try to bring this a bit better under control, recognizing this is the holiday season, and all institutions are contained. My colleague Nicole also highlighted last week Kingston was at 115 per 100,000. So they've actually tripled from 115 per 100,000 to 350 per 100,000.
Thank you.
Any questions from the Windsor Star?
Yes, good morning. More than 57,000 people locally have received 3rd doses so far, but when the floodgates open on Monday, how many people will become eligible?
We can try to get you that number. I'd hate to speculate on that number, but we can try. If you send us an email, we'll try to get you an exact number or a more accurate estimate.
Okay, well over 100. It's well over 100,000, but we can get you the exact number. We'll send it in an email.
Okay, based on the number of people who've received 2 doses, which is more than 300,000, I expected a very high number, but I'll send an email. And then separately, do you expect an ample supply of vaccine and a steady distribution this time around, considering how many people will be eligible all at once? Steady distribution from the province, not on locally.
Well, we've been we rely on the province to procure and provide vaccine to the health district, and we'll continue to have dialogue with them. Up to this point, we've been able to have sufficient supplies to meet our demand, and I expect that that will continue. We always are concerned about every part of the supply chain, and we'll continue to have dialogue with the province to ensure that the supply chain remains robust for the district.
Thank you.
Given the time, just one additional question. Any additional questions from AMA 100?
No, thank you.
Any additional questions from Radio Canada?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
Nope, I'm good.
And any additional questions from the Windsor Star?
No, thank you.
Okay, thank you, everyone. We'll see you again on Monday, December 20th. Have a good weekend.
Thank
All
you.
right, all the best. All right,
Thank you.
bye-bye.